Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today we are joined by County Executive Armin Budish, and from the Board of Health, we have Health Commissioner Terry Allen and Director of Epidemiology, Surveillance, and Informatics, Jana Rush. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. I hope you all had a wonderful New Year's weekend, and I hope you and your families were able to avoid the virus. I again want to thank our Cuyahoga County Board of Health Commissioner Terry Allen and his great team for all that they do. It's been almost 2 years that they've been working day and night to protect us. We owe them a whole lot of appreciation. Okay, so with Omicron running rampant, are you comfortable being with other people? What's your risk if you go out to a restaurant where people have to remove their masks to eat? How about a small party with friends or a meeting in a conference room at work? None of us wants to lock ourselves away in seclusion for weeks or months, but we also don't want to get sick. How can we make the best decision whether or not to venture out in each different circumstance? There's no magic bullet solution, but there are several COVID risk calculators online that you can use for free to help you evaluate the particular risk factors in any given situation. One that I've looked at is the COVID-19 risk calculator by the Harvard T.H. Chan School of Public Health. Using it is very simple. Even I could figure it out without having to call my son for help. It'll ask you a bunch of questions focusing on the most important risk factors. Your answers will help you decide whether to go out or stay home. So let's try a little demonstration here. Let's start with a situation which is very low risk. We'll say the room you'll be in is large, and the time you'll be in the room is an hour or less. You'll be sitting, not walking or exercising or running around. Everyone is wearing an N95 mask. People in the room don't shake hands. And social distancing rules are followed. With all that, the risk of infection, we'll calculate it, as you might guess, is very low, less than 1%. But now let's change a few answers. Let's say you're in a small restaurant. You're there for an hour and people are not wearing masks while they eat. Your risk changes. Goes up to about 4%. If you eat leisurely over 2 hours, your risk goes up again, this time to about 7%. If the tables are close together and not socially distanced, your risk changes again. Oh, you rushed ahead, Jonathan. You hit the moderate activity. We're not quite there yet. So we got about 10% there. Now, if you're at a loud bar or a party where people walk around with a drink and talk loudly to be heard over the crowd, your risk skyrockets. And that's what we just saw. Your risk goes up over 90%. Now, the actual risk score is really not what's important here. The risk calculator and others like it, and there's a number out there, are helpful because they can help you think through the most important risk factors before you go out. They can help guide your decisions, and they can be sort of fun to play with too. You can find the Harvard risk calculator at the website. I won't try to read the whole thing, at the website on the screen. It's easier if you just search on Google for Harvard risk calculator. Remember, the goal is to keep you as safe as possible. So when you go out, wear a mask, social distance, and please, please, please get vaccinated. The government alone can't protect you. You have to take personal responsibility. It's up to you. Thank you.
Thank you, Executive Budish, as always, for your support of our department and the work we're doing. It has been 2 long years, and I think you brought forward certainly a vetted risk calculator from Harvard, well-respected school of public health. And, the message there, folks, is if you're in a place where people are close together, they're not mass, particularly among unvaccinated people, and you're interacting with them for a long time, that Omicron is coming for you. And that's just the reality of where we currently sit. I think it's a great way for you to estimate risk and to make assessments about what sort of risk tolerance you're willing to take and how it relates to the people that you also care about. So it's been a few weeks since we last briefed you, where we discussed the impending surge in cases and the rise of Omicron that we all experienced over the holidays. Omicron has obviously eclipsed Delta and is a dominant strain, and that occurred in just a few weeks' time. It really is happening at breakneck speed, with over 90% of our cases now are from Omicron strain here in the county. I think nationally the data is over the last week or two. The current new cases, it's at 95%. So that is an incredible demonstration of the infectious nature of Omicron. So over 90% of cases, I said, are from the Omicron strain. And consequently, because of that spread from person to person with Omicron on the center stage, our rate of transmission has skyrocketed. And you'll hear more about that from our Director Rush, who will talk about that during our EPI brief. Frankly, if you're unvaccinated and unmasked in indoor group settings, you're really asking to be exposed to Omicron, which may be the second most transmissible infectious disease in the world. Public masking in indoor spaces is still only about 50% in any of the retail locations that our folks check out in the community. Some large retail and food service operations are requiring masks for their employees with lower rates of employee masking in smaller businesses. So we'd ask businesses throughout the community to protect your employees and promote masking, and to promote masking as much as possible where you can require masking for your patrons to help to slow this surge down. With Omicron, it's best to use a surgical mask if you can for the best protection. Social distancing is also lower. We know people are tired, and people are certainly traveling a lot more than they have in the past. All these things can interact and affect our current surge in a negative way. The rates of first-time vaccinations has been slower. We've seen an increase among people seeking boosters, and we'll talk about that in a moment, and that's a good thing. It's very concerning, certainly, to think about this, and this statistic has held. These two statistics have held true, and that was for all of last year and our current time frame. 95% of the people that are hospitalized and 95% of the deaths in the state of Ohio were among unvaccinated. We also know that flu activity has picked up in the county, and the predominant flu strain that's circulating this season has historically been associated with higher levels of hospitalization. The flu vaccine can prevent complications like pneumonia and ultimately save lives, just like the COVID-19 vaccine does. We want to prevent a twindemic. We do see flu circulating now, and it's just another risk factor that we need to consider. So please get vaccinated for both. They're tried and true ways of stopping flu and stopping COVID. So it's important also for us to think about the fact that hospitals continue to be inundated with patients in addition to other seasonal illnesses and emergent issues. The Ohio National Guard, as you know, are supporting area hospitals that have been in need of employee support at critical positions to maintain healthcare capacity during this surge. And this is the high illness rates among healthcare workers has also compounded this problem. And so we really appreciate the service that the Guard's performing, not only here in hospitals, but across Ohio. They had to step away from their holidays to step in to make sure that our hospitals were there to serve all of us. People who otherwise would be admitted to the hospital, though, for a condition in normal times may be required to stay home and communicate remotely with their healthcare provider to monitor for symptoms, given the high demand that we're experiencing. We know elective surgeries, as you've all read, have continued to be canceled and visitation has been significantly restricted. And we remain in crisis mode. The unvaccinated continue to drive up this hospital surge. And I'll repeat that. The unvaccinated continue to drive up this hospital surge. Getting both your COVID vaccine and flu vaccine again can protect our hospital capacity so that they can care for everyone who needs help. On the vaccination front, about 60% of the residents of the county have been fully vaccinated, according to CDC's current definition, and that means they've gotten 2 doses of mRNA vaccine, that is Moderna or Pfizer, or a single dose of J&J. In terms of vaccine equity, about 39.5% of African Americans and 54% of Hispanic Latinx population have been fully vaccinated. Many of us do continue to remain unvaccinated and vulnerable to contracting and spreading Omicron in the community. Vaccinations continue to be readily available just about everywhere at health departments, pharmacies, hospitals, community health centers. All you have to do is go to the Get the Shot website at the Ohio Department of Health to find a vaccine. And this has always been our way out of this pandemic. It's the best way to prevent hospitalizations, to prevent deaths associated with unvaccinated people. And we also have the dates of all our clinics and times available on our website if you want to look for a clinic through the health department. Booster doses for Pfizer, Moderna, and J&J are available for eligible recipients, and to date, over 44% of the fully vaccinated population in the county has received a booster dose, the best way to protect against severe illness from Omicron. The Ohio Department of Health is reporting that to date, only about 18% of children aged 5 to 11 are fully vaccinated, and about half of kids aged 12 to 17 are fully vaccinated. We strongly encourage parents to get eligible kids vaccinated. CDC approval for booster doses in the 12 to 15-year-old age group is anticipated to occur soon. And then once that's approved, the Ohio Department of Health will provide guidance so that we can then begin administering boosters for that age group. Omicron has caused a significant increase in hospitalizations among our kids, and many kids still remain vulnerable. Consequently, we encourage all schools to require universal masking for all students and staff during this unprecedented surge, and Governor DeWine has made the same request. I'd like to thank the Educational Services Center of Northeast Ohio and all of our school partners for their perseverance and commitment to the health of their students and staff throughout the pandemic. It's been very difficult for them to do the best they can to educate the students, our future here in Cuyahoga County. On the testing front, there's been an enormous increase in demand for testing, and remind everyone to get tested if you're experiencing symptoms, and are seeing, of course, high demand for testing throughout the county, particularly over the holidays. We advise you to go to retail pharmacies to get tested, particularly if you're asymptomatic, if you're a student or a patient. The Walker Center site downtown on the Cleveland Clinic campus, which is also supported by the National Guard, has lots of capacity there and has appointments currently, even today, available for testing as well. And you can book an appointment by going to our website at ccbh.net, listed behind me. If you select on the right side, the drop-down menu for you choose COVID-19 from the drop-down menu, and then you choose COVID testing from that menu. You can scroll down and you'll see a link to get an appointment for the Walker Center. You're required to have an appointment. And again, it looks like from the data we checked just before this meeting that there are appointments as soon as today available for testing. Area libraries continue to distribute test kits that they get from the state as well, and when they're available. But it's good to call ahead to the branch near you to assure that they have kits in stock. because they do come in waves from the state, and given the high demand, they may be out from time to time. And we continue to supply kits as we receive them to address needs in a range of high-risk settings for contact tracing support and for outbreak control in places where we're dealing with outbreaks to try to prevent further people from getting sick. If you live in suburban Cuyahoga County, you can go to our website at ccbh.net also to report a positive home test if you do take a positive home test. Please don't go to the emergency room to seek testing because they will not be able to provide it there given the surge. We need to keep those spaces available for people that may show up with a heart attack or may be in a car accident and available for service. And if you're unable to test right now, please stay home if you're sick to reduce exposure to others. And remember, as demonstrated in the risk tool that Executive Budish showed, smaller groups among vaccinated people is certainly always the best approach if you're going to get together. Now, I'd like to encourage businesses that have the ability to implement remote work to do so during this surge to reduce spread in the work environment. We appreciate all those restaurants that have the ability and have chosen to implement carryout or home delivery as an alternative to in-person dining to reduce exposure among patrons in that setting as well. I'd like to offer a specific special thanks to Playhouse Square and other theater venues that require proof of vaccination to attend. If you think about it, these are environments where there are lots of people together, close together, and they're sitting next to each other and for long periods of time. And that's certainly the risk calculator there would demonstrate the risk associated with that longer time frame. So we really appreciate their commitment and demonstration of leadership and their commitment to public health. And we'd encourage other entertainment venues to follow their leadership in requiring proof of vaccination for entry. Now, I'd like to turn it over to Director Rush for the data report. Thank you.
Okay, good afternoon. We are going to pull up the CCBH data dashboard. Okay, so just to provide a general overview of where we are to date with the pandemic. So as you can see here on the main page of the dashboard, we are currently have exceeded more than 165 or nearly 166 total cases reported year to date since the pandemic began. Currently, we are number one in Ohio, unfortunately, in relation to the number of COVID-19 cases that are being reported per capita, and that's 3,023 cases per capita that are being reported within Cuyahoga County. Our current daily average for the jurisdiction is an average of 2,000 cases are currently being reported daily. And if we compare these data and numbers to where we were at this same time last year, so in January of 2021, we were averaging about 425 cases per day. Our surge started to happen in September, October, November. In December of 2020 going into 2021. So in January, we started to tail off of that surge. So that's just to give some perspective. So that's over a 400% increase in the number of cases that we're currently seeing in January compared to the same time last year. The other thing I'll talk about here on the main page is the number of deaths. So we've had nearly 2,000 deaths reported to the district overall, and 2,800 for the county overall. So the information you have reported here won't exactly align to some of the numbers that I'm stating as different data sources are used. And the ones I'm stating here are from our vital statistics data. And currently we're averaging about 30 deaths per week. And so again, to give some perspective of where we were last year in comparison to where we ended in 2021. So in 2020, there was a total of 1,069 deaths that occurred versus 925 through the end of 2021. So that's specifically for the Board of Health district. So that gives you the indication that the deaths are slightly lower than what we saw in 2020 versus 2021. And so now we will go to the hospital utilization tab. Okay, so this data shows the hospital utilization rates for different types of beds currently in the hospital. And the one that I'll draw your attention to is the third from the top, which is the critical care adult bed usage. As you can see here, we're at about 82% utilization. And you can see from the chart that we've been really climbing up for this indicator as far as hospital utilization. We've dipped down slightly for the top bar graph that you'll see there. We've dipped down slightly. We're still at about 80% utilization for just general adult beds in the hospital. And so we're paying attention to that because nearly 2,000 COVID patients are currently hospitalized in Cuyahoga County, and that's climbing. And so our 7-day average is currently 180 admissions are happening daily within Cuyahoga County for COVID-19 cases. And so we're paying close attention to those hospitalization rates as hospitals are, needing to provide critical care for patients that need to seek care. So that's where we are for hospitalizations. And so now we'll go back to the main tab and then transition to our testing tab. Okay, so this shows a histogram of our electronic lab reporting data that's reported through all the hospitals and labs throughout Cuyahoga County. And so as you can see in this chart, currently we're showing over 30% positivity in Cuyahoga County. And we know that some hospitals are reporting even higher positivity rates than that. And this has about a 2-week lag. So we could be upwards to 50% or more of positivity rate throughout the county currently. And so as you can see with this graph, you see some of the dips that happened just several weeks back before the surge began to happen in September. And you can see now we've eclipsed where we were even from the beginning of 2021. So just unprecedented number of cases as well as positivity rate, especially since more testing is becoming more available and coming online for the population to test quickly. So that's currently where we are for positivity, and we can go back to the homepage. And now if we scroll down on the page, this is where our COVID-19 vaccine data dashboard is. And as Commissioner Allen stated, almost 60% of the Cuyahoga County population has currently received or completed vaccination. And so now we have data as well on the number of people who have received a booster dose. So about 25% of the population currently has received the booster dose. And so that booster dose, I know it's probably a little small, but those green bars that you now see at the end of the chart, that shows week by week how many people have received their additional booster dose since those became available. And so the blue chart shows those that started vaccination, and then the orange bars on this chart shows those that have completed vaccination week to week. Okay, so we can go back to the homepage. Okay, and so the other thing that I wanted to cover and provide some updates on, as we've seen in the news recently, the Centers for Disease Control has updated the isolation and quarantine guidelines, and ODH, the Ohio Department of Health, has also adopted those guidelines, as well as the Cuyahoga County Board of Health. And so those took effect here at the Board of Health on December 30th, 2020. So there are 3 primary changes that are happening in relation to our isolation and quarantine, or categories in relation to isolation and quarantine. So first I'll cover isolation. So for isolation, the requirement is that no matter your symptoms or your severity of illness, if you are diagnosed with COVID-19, everyone is required to isolate for 5 days in their home. and that isolation ends as long as your symptoms have improved and you are fever free for at least 24 hours. And so that is the current isolation guidelines, and you are to wear a mask after your isolation ends for the next 5 days around others. And so that covers isolation. The second category is quarantine. And so quarantine guidelines have also been updated. So the primary change here for quarantine is similar. So you are required to quarantine if you are not up to date on your current vaccine series for COVID-19. So what does that mean? So that means if you're not up to date, it means that either you're unvaccinated or you received one dose of the Pfizer or Moderna vaccines, or if you've only completed the primary series of Pfizer and Moderna more than 6 months ago, and if you completed only the Johnson Johnson primary series more than 2 months ago. So that means you haven't received a booster dose for either of those vaccines. You are required to quarantine. So those are the primary changes in relation to isolation and quarantine. We have all this information posted on our website as well, where you can go and look up that information on the new isolation and quarantine guidelines. If you are a healthcare worker, we are encouraging you to reach out and work with your employer, as there may be alternate quarantine guidelines if you are a healthcare worker. And I think that is everything that I had to cover. And so I will turn it back over for any questions as well as to Commissioner Allen. Thank you.
Thank you all for your remarks. We now have a few minutes for some questions. Just a reminder to please state your name and media organization, and remember to stay muted when not speaking, so we can take a question.
Hi, this is Lisa Ryan from IdeaStream Public Media, and I'm wondering how accurate these numbers are if people are potentially not reporting at-home tests, or perhaps not able to find a test at all.
Thank you, Lisa, for your question. Happy New Year to you. I think you're right that we've had this discussion not only at the state level but the national level with the influx of home testing, many of which are no longer proctored. We do ask people to self-report those. We know that many people don't. In fact, many of these home tests are being used as screening tools for people to make decisions about actually relative to the risk calculator that Executive Budish described, making decisions about what they want to do and not do based on the results. And so we're hoping that if they test positive, that they stay home, that they don't interact with others, and that they follow the guidance associated with isolation. So those numbers are a bit lower. And frankly, in the context of this unprecedented Omicron surge, absolute numbers are less important than what's happening with hospitalizations, right? What we're concerned about is if you have lots and lots of people exposed, then even with that huge number, there's going to be a small subset that are at risk. They may have organ transplants, they may have comorbidities like diabetes or other respiratory illnesses that put them at particular risk for complications from COVID. So that could put them in the hospital because they have these risks. And so we need to be thinking about the fact that these home test kits are tools for people to use to understand their risk and then avoid interacting with people that they love or people that they work with, or walking around without a mask and expecting, that they won't be exposed to Omicron, because that's not going to happen. If you're not wearing a mask, your likelihood of exposure has never been higher. So use it as a testing tool, and recognize that we're watching the hospitalization numbers to understand just how Omicron is affecting the community, because the infectious nature of Omicron has changed the way that we look at overall numbers. And the surge is now beginning to spread not only in the north of Ohio, but lots of other places. And it's happening not just in Ohio, but across the country.
Thank
Thank
you.
you.
Any other questions?
Hello, this is Michael Andriola. I'm a reporter at The Land. So I've been going over zip code level data for the COVID-19 vaccination rates throughout Cuyahoga County, and several of Cleveland neighborhoods are the least vaccinated areas in the county, while suburban areas outside the city are the highest. Essentially, urban zip codes generally have lower vaccination rates than suburban zip codes. I was wondering if you could provide any insights into the reasons for this disparity.
Thank you for your question, Michael. And, we've talked about this from time to time in our briefings over the last many months. We know that there have been some concerns about vaccination, certainly some fear. Some people are concerned about risks associated with the vaccinations. There have been many, many efforts, outreach through the Cleveland Department of Public Health, through the federally qualified health centers and clinics that we provided in the community to offer vaccination. Ultimately, it's a personal choice, but we know even working with the Rapid Response Fund, which is the response group among the foundations that have pulled together grassroots agencies that we met with weekly for a long time, where these grassroots agencies were aware of where all the clinics are, and they had close contact with folks in the community to try and make sure people knew where they could get vaccinated. How they could get to vaccination sites. I think there's still a bit fear about the vaccine because it's new among some populations, and we want to respect that. But also, we think now it's important for people to really recognize that if we want to get to the end of this pandemic, we want to make sure that everyone rolls up their sleeves and gets vaccinated. And particularly, we want to make sure that we continue to offer locations for the African American community, for the Hispanic Latinx community throughout Cuyahoga County to be able to get a vaccine close to home. And we're going to committed as a public health agency, that's our North Star. We're committed to continue to offer those vaccine locations. And we use the data that you're describing to drive the locations of those clinics and make sure that they're in neighborhoods, they're at churches and community centers and other places that are close to home for folks that may have transportation barriers, for instance. But that is something we're committed to continue to do, and we need to do better. And we hope that others will encourage people to get vaccinated. We know that as we move into this deeper into the pandemic, all of us know people that have been affected by COVID. All of us know people either directly in our own family or friends that have lost family members from COVID. And these are tragedies that many of them dealt with over the holidays. Let those moments of that pain and suffering that people went through, let it be an opportunity for people to share and try to spare others from similar situations by encouraging someone maybe that was waiting to get vaccinated to do so now so that they can protect themselves and the people that they love. And again, this is our way out of this pandemic that certainly we've been hoping for so many months. We think that's certainly the way out. So thank you for your question.
And I just might want to add here, if you're vaccinated, you may be thinking to yourself, look, I'm protected at least from the most serious of problems, and I won't go into the hospital most likely. So it doesn't really matter to me if, my neighbors don't get vaccinated. That's their choice. They get sick, they go in the hospital. But it does impact all of us, because if they get sick and they go in the hospital, they're taking up a bed, which if you have an auto accident or you have a heart attack or a stroke, that bed may not be there for you because somebody who was not very considerate decided not to get vaccinated. That's a problem for all of us.
Thank you. Any other questions? Okay. Thank you all very much for your questions. Really appreciate it. That concludes this week's briefing. Thank you so much for joining us, and we will see you in a few weeks. Have a great day.